Dr. Davis is a director of medical operations at Elite Medical Group. She's responsible for overseeing Elite Medical Group's telemedicine operations. Prior to joining Elite Medical Group, Dr. Davis was the senior doctor in charge of the Norwegian Cruise Line's Jewel Medical Department. Previously, Dr. Davis was an attending physician in the emergency department at Walter Reed Army Medical Center in Washington, D.C., and at St. Alphonsus Regional Medical Center in Boise, Idaho. She has extensive experience in emergency medical services and served as medical director of EMS at both Walter Reed and St. Alphonsus. So guys, give it up to Dr. Davis real quick. Dr. Davis, before we jump into the tough questions, and having just shared your bio and your credentials with everybody here, let's break the ice a little bit. Can you share something with us that is not encapsulated in your CV or your bio? Something that we'll all remember.
Okay, sure, Ryan. Well, maybe how I kind of got interested in global rescue. Working on a cruise line, a lot of times as a physician, we have to evacuate people off the ship. For anybody who's been on a cruise, that may have happened. So I had to do that frequently, and the experience with that was often variable in terms of the quality of evacuation services we dealt with. So as I was looking into things like global rescue, I was very impressed with the quality of the service that they offered. Another great thing with working on a cruise line is you get to travel all over the world and see some very interesting places. And in case anybody ever goes into the witness protection program, I highly recommend the Faroe Islands because nobody will ever find you there.
Great tip. I'm going to write that down. All right. Well, now for some not so difficult questions. When I need help, how quickly do I get that?
Well, our teams are available 24/7, so you'll get somebody right away. You'll get to talk to one of our paramedics, nurses immediately, and they can provide advice right away. And then if you need to talk to one of our physicians, depending on the type of need that you have, call volume, availability, often it's immediately, and then other times it may be that we need to call you back so that we can get the right clinician for you.
All right, great. Thank you for that. You know, we're talking about shifting tide and a shift in how healthcare is delivered. How do you see virtual health interactions matching up with some of the major trends that we see occurring right now in healthcare?
Well, there's a big sea of change happening in medicine nowadays, and access to healthcare is one of the big things, and virtual health is really on the forefront and is the future. So in our busy lives, being able to talk to somebody through a video conference and not having to either sit in a waiting room or make an appointment and wait many days is really improving access to healthcare, and I hope the quality as well. That way we can improve our access and quality at the same time. In addition, as Dan had mentioned, the financial portion of healthcare nowadays has really skyrocketed and gone out of control. And for instance, just a visit to the emergency room can cost you about $1,300. A visit to your primary care physician might be $150 to $200, or even an urgent care center. So being able to help control those costs, and many of those, maybe with just some advice over the phone or through a video, people might not even need those types of visits. So we're hoping that people will be able to actually save a lot of money with this system as well.
Yeah, great. That's what we're all counting on that. Now, you know, let's talk about second opinions. If I get, or somebody, one of our members gets a diagnosis from their primary care physician, what's the process that we follow to initiate that second opinion service?
When a member has something like that and they would like a second opinion, they would usually contact us. We'll do an initial consultation, and they'll have that with one of our clinicians. We'll gather their medical records and then send that on to for a second opinion. And that could be either with one of our subspecialists through Elite Medical Group, or it could be with our second opinion partners that I mentioned earlier with either Harvard or Johns Hopkins. They will formulate the second opinion, get it back to us. We'll review it with the patient, and that that way they can make an informed decision about their care going forward. And so when they have, pretty concerning medical problems like a diagnosis of cancer, or they're trying to decide do they need surgery or not, having a second opinion can be very helpful.
Right. Now, I've used the service twice, and both times I received phenomenal follow-up calls from members of the MedOps team. Can you describe how that works, and why are these follow-ups important?
Well, having follow-up after you have a medical visit is really important. It lets the provider know if the treatment that they've prescribed is working, for one thing, and if it's not, if the patient has new symptoms or worsening symptoms, then they can either change treatment, do further testing, or provide referral if necessary. So that's something that's really important. Our team is very dedicated to doing that, and we all feel that that is something that we're focusing on quite a bit with our TotalCare providers.
Right. Well, last but not least, here comes a big one. We talk a lot about revolutionizing how people access health care. That only occurs when people change their habits. So as a doctor who's practiced traditional medicine for so many years, how do you talk to people so they can feel comfortable changing their habits and starting to talk to a doctor virtually through the phone or through video?
Well, some of that is just sort of getting used to the process. But I think if we can get our members to remember that I do have this sinus infection on Sunday afternoon. Oh, I have somebody that I can call. Or my child has a fever in the middle of the night. There's somebody that will be on the other end of the phone. Just having that available will help to change habits. If you need a note for work because you've been sick and you don't want to have to wait in line at an urgent care or an ER on off hours, then remembering that there's somebody that you can call and talk to will help to change habits as well. If you need a second opinion for some serious medical problem, just having someone who can sort of handle that for you and find the specialist for you takes a lot of the anxiety away from dealing with that when it's a very difficult time for you and your family. So that can really help as well, and all contribute to helping to change habits, and hopefully people will think of us and give us a chance to help them.
All right, great. Well, thank you so much. Guys, can we give it up to Dr. Davis, please? We threw a lot of questions at her, fast and furious, and she did a great job responding. So thank you so much for all that you do for Global Rescue, and we look forward to working more closely with you.